Okay, for an IM injection, I need my pound of flesh for my patient. I need my medication, a properly sized needle, no more than 1.5 inch if it's gluteus, or 1 inch for deltoid. I would need 2 alcohol swabs, pretend both that's 2, and my gloves. After collecting my supplies, I enter the room and perform hand hygiene, identify myself to the patient, and perform 2 forms of identification. After checking my 7 routes, I would have checked my medication both 3 times. When I first selected it, when I go to draw it up, and directly before administering it to the patient, and that includes dosage and amounts, as well as expiration date with the 7 rounds. Probably before entering the patient room, I would go ahead and draw it up. Say my order is for a mill of heparin, making sure that I keep the ends from touching myself or anything else but each other because they are still sterile. I would attach my needle. Before taking the cover off, I would take one of my 2 wipes and clean the top of my bottle for 15 seconds. Pretend I did that for 15. While letting it dry, I would go ahead and uncap my needle, draw back approximately 1 ml, about the same amount as I'm actually going to administer. Turn the needle, inject it into the bottle, flip it over, inject my air slowly, and then I would slowly drop. See how that actually is pulling back a little bit from the pressure of the bottle? And I would pull back slowly. I have got a large air bubble, so I'm going to pull it back a little bit past and flick the air out. I've got a little bit one by the plunger. And then inject that back out. Making sure that the plunger is at eye level, exactly the same to the actual dosage mark. I would pull that out.
Oh, great. Elegant.
Thank you. I try. I would recap my needle. This would be especially appropriate if I were not doing this at the patient's bedside. If I drew it up while I was in the med room, I would label it. And again, double check all of my medication amounts and check it with the MAR. Label it both with my initials, the amount, and the patient's name. At this point, I would have gone into the patient's room, and after doing my identifiers and setting up my station and doing my hand hygiene, I would select my location, pretending that this is the deltoid muscle. I would clean, starting at the center, working my way out. And while I'm letting that air dry, when I've double-checked my medication for the last time, like 5 times over, I would put my gloves on. And this being IM, I'm going to give it at 90 degrees. So I have my location, it's dry, uncap the needle. Using my dominant hand, I'm going to take it and make sure I just have my area gently stretched with an IM. It doesn't have to be stretched as much, you just need to know exactly where you're going to hold it. Holding it fairly short distance away and making sure my fingers are clear. I'm going to take it 1, 2, 3 down, and according to the AB Tech policy, inject the needle all the way in. At this point, I take my non-dominant, embrace it, change position, and inject the entire amount slowly and smoothly into the muscle. At this point, I would take a gauze pad and set it next to the needle. I would draw it up, point it towards the ceiling, and apply gentle pressure to the location. After 10 to 15 seconds, I would check it and make sure that it is not aspirating back out the hole, bleeding. I would also have flipped my safety on, and I would take this to the sharps box, which I should either have with me or on the med cart next to the room door. Ideally, it should be in the same room within reaching distance. After disposing of my needle, which I do not recap, I would clean up my dirty supplies, deglove, wash my hands, and document.